Welcome all to the episode 10 of the Transfusion Squared episodes. Today, we will be discussing about the week D testing. How do we test for week D, its relevance, and how do we report a week D for the patients and the blood donors. So, I have Dr. Jaya Gauri with me, and she will guide you step by step as to how to proceed for this testing. Over to Dr. Jaya.
Thank you, ma'am. To begin with a scenario, a donor sample was tested for ABO and RH. The RH status of the donor was D negative. Whether the donor is actually D negative or a weak D variant, we need to know that because a weak D donor unit is considered as a D positive unit. We will be performing the AABB method 2-15 testing for week D. The items required are donor red cells, 2 to 5% suspension of the red cells, 2 test tubes neatly labeled, one is anti-D, the other is control reagent. The reagents that we use are anti-D reagent, which is monoclonal blend of IgG and IgM, AHG reagent, and a control reagent. Along with that, we will be using 0.9% saline for washing purposes. Coming to the contents to be added, first we will be adding anti-D reagent, which is monoclonal blend of IgG plus IgM, 1 drop into the tube labeled as anti-D. Next, we will be adding the control reagent, which contains chemical potentiators, 1 drop of it to the control reagent tube. Now we will be adding 1 drop of 2 to 5% suspension of donor red cells in both the tubes that are labeled anti-D and control reagent. Now we will mix the contents well. The tubes will now be incubated at 37 degrees centigrade for 15 to 30 minutes. After incubation, the tubes will now be placed into the centrifuge for reading, that is 1000 rpm for 1 minute. Following centrifugation, we will have 2 neat buttons at the bottom. Now checking the reaction with the control reagent. The control reagent reaction is supposed to be negative as the reagent contain only potentiators. Next is the anti-D tube, in which the reaction was observed to be negative. So at 37 degree, both the control reagent and anti-D reagent gave negative reactions. Now we proceeded with washing of the tubes using 0.9% saline. So about 3/4 of the tubes, both anti-D tube and the control reagent tube, was filled with 0.9% of saline. Then placed into the centrifuge, and the same method was repeated 3 times. After this was the third wash. At the end of third wash, the saline was completely drained off and complete decan was performed. Now, in both the tubes, the anti-human globulin reagent, 1 drop, was added. Now we are supposed to mix the contents very well so that the button is dislodged. Now placed in the centrifuge for reading purposes. Once the centrifugation is complete, we will again have 2 neat buttons at the bottom of the tubes. So we will observe the reaction in each of which. Beginning with the control reagent gave negative reaction. So therefore the test we did is valid. And coming to the anti-D part, the anti-D also gave a negative reaction in the tube. So it was observed that both the control reagent and anti-D tubes gave negative reactions, indicating that the sample is negative for weak D and therefore actually RHD negative. When a similar reaction with positivity in anti-D as shown here along with a negative control reagent, then the donor sample is considered as a D positive unit. In case if the sample was that of a patient and not that of a donor, then the recipient or the patient is considered as a D negative recipient and will be transfused with D negative blood.
Thank you, Jaya, for taking us into the detailed explanation and showing us how to proceed with the weak D testing. And we will be discussing about the variants of D, the indications of weak D testing and their relevance in a special episode. So stay tuned for that. And if you have any queries regarding the test procedures, you may please drop in your queries in the comment section.